Hi, everyone. Welcome to our May 2026 KBH Plus co-hosted with Child Bright Implementation Community webinar. We're very excited to have Dr. Fontaine here today to share more about the selected tool. So today's webinar is titled How to Choose the Right Theories, Models, and Frameworks in Implementation Projects. Let's talk about Select It. I know people are still joining in as we start today, but we have lots of great content to share and want to leave some time for questions and discussion. So we'll just get started.
Sounds good. Thank you. I'm going to share my screen if that's all right.
Oh, I'm going to do a little bit of a quick
Oh,
introduction. That is okay.
sounds good. Okay.
And yeah, so about 5-ish minutes, and then I'll pass it right over to you. Sorry, that was very misleading. All right, so to ground today's webinar, starting with a land reflection. So my name is Vanessa, and I have the privilege of being the KBH Plus implementation community facilitator. I also have the privilege of being a postdoctoral researcher at McMaster University in Canchild, which is located on the traditional territories of the Mississauga and Haudenosaunee Nations, protected under the Dish with One Spoon Wampum Agreement. Recognizing people are joining today from all over different institutions. We encourage you to share a little bit about your locationality in the chat if you're comfortable. If you would like to learn more, there's many resources available regarding where you're located and the lands you're located on. There's a link at the bottom of the slide here. And if you're still on your learning journey, we commend that as well. And please feel free to share whatever you're comfortable with. We always try to couple land acknowledgements and reflections with action and accountability. So I put an article on the slide here today, and while this isn't specific to decolonizing implementation science, I think there are a lot of common principles in terms of what is shared in this work. So we're seeing a lot of emerging research and important insights around decolonizing implementation science. And this paper speaks a little bit to our primary focus a lot as implementation scientists, practitioners, people involved in this work around deductive application of knowledge, thinking about theories, models, frameworks. And I thought this was particularly appropriate for today's session. And so the authors of this article challenge some of our deductive approaches and encourage us to think more about inductive approaches and reasoning. So leveraging different community, patient, family, clinical knowledge in terms of how we're doing and interpreting implementation work and research. And again, thinking that this is particularly appropriate for today's session around theories, models, frameworks. And Dr. Fontaine does a beautiful job, him and his team, at talking about different attributes to think about in theories, models, and frameworks. And I think that ties really nicely into some of the learnings from this paper. And obviously, I'll let him share more when he presents, but something for us to think about today. Quickly, KBH's implementation community is all about building connection, community, capacity in the field of implementation science for those working, living in the neurodisability space. We have public webinars like today, as well as smaller community chats for KBH-funded projects where we share questions, resources, and problem solve together. So Kids Brain Health Plus comprises 3 main entities, all with the goal to improve the lives of children and young people with neurodisabilities and their families. So the KBH Innovation Fund is fueled by impact investing to scale and spread proven effective innovations, really about commercialization pathways, commercialization related to new ideas, innovations, effective solutions. The KBH network is funded by the federal government and is all about driving innovation, implementation, and impact. And then the KBH Foundation is funded through philanthropy, really about increasing and spreading reach and access of these innovations funded through the Kids Brain Health Plus. And all of this is done in collaboration with networks, organizations, communities, such as this webinar co-hosted with ChildBright. Pass it to you briefly, Audrey.
Good afternoon or good morning, everybody, depending on where you are. I'm in Oakville, Ontario, the land of the Haudenosaunee and the Mississaugas of the New Credit, and pleased to be here representing the ChildBright Network. I've been working with the ChildBright Network as co-chair of the Training and Capacity Building Committee for about a year now. My co-chair colleague is Celia, who some of you may know. She's very connected in this community. And I bring to the group, I'm a parent. My son had a stroke when he was 5 and has limited use of his left side. So I've certainly worked with the system, worked in the system, worked within the system as a parent advocating for children with brain-based disabilities. So we're a wide network similar to KBHN, housed primarily, we have kind of 2 houses, one at McGill and one at UBC, and then we have a broad network across the country. We do all kinds of things. Our mission, thanks for forwarding the slides, Vanessa, is to work with youth and parent partners to foster a brighter future for children and youth with brain-based disabilities and their families. We engage youth and families in our research, and our focus is particularly maybe a little bit different than KBHN, but it's on pediatric brain-based disabilities. So happy to be here, and thanks to Vanessa for giving us a few minutes on the Zoom call, and looking forward to Dr. Fontaine's presentation in a few minutes.
Thank you so much, Audrey. Okay, a few quick housekeeping as always. You're welcome to share your comments, your questions in the chat. There's also a Q&A feature that you can see in the panel as well if you would like to submit questions through there. You can also raise your hand and request to be unmuted. Your videos will remain off for the webinar, but we encourage you to share your thoughts and reflections in the chat. Okay, so before getting started, we want to do a Zoom poll very quickly to understand who's in the audience today and understand how we can better equitably engage our members and the broader community to attend these webinars, as well as getting a quick pulse check on where people are at in terms of their knowledge with the topic of theories, models, and frameworks. So I'll give everyone a moment to do that quickly. Okay, so we're getting a range. One person extremely knowledgeable. We have a few knowledgeable. Most are in the somewhat knowledgeable, Dr. Fontaine, and then we have also a few in not at all knowledgeable. So I would say majority are in that somewhat knowledgeable, identifying in that range. So we hope today's session will be particularly helpful for you, but also everyone in attendance today. We'll end the poll there. Okay, so I will pass it over to you now.
Excellent. Thank you so much. Let me share my screen. Okay. See my slides, is that okay? Yes, all good.
Oh, sorry. Yes, I was head nodding. You couldn't see there.
Okay,
Yes,
so
all good.
sounds good. Thank you so much. So it's great to be able to talk about implementation science and how it can help in different quality improvement efforts, implementation efforts, and specifically talking about theories, models, and frameworks, and the selected tool that we've developed and published last year. My name is Guillaume Fontaine. I'm an assistant professor at McGill University. I hold the Canada Research Chair in Implementation Science for Health Systems Transformation since last month, so it's pretty recent. Um, yeah, so here are my disclosures briefly. At McGill University, I lead the RISE Lab, an implementation science lab really focused on applying implementation science methodologies, not necessarily in the disability space, but really in the infectious disease space. But we do a lot of implementation science work around developing different methods, theoretical approaches, and tools. And I work with a fabulous team, some of which you can see on the screen. So a range of PhD students, postdoctoral fellows, master students, and research staff, bringing a great diversity of perspectives, given our team comes from many different countries. So that's what I love. So in terms of objectives, some of the three things I'd like to talk about today, really talking about the selected tool, and how it can support you to choose theories, models, and frameworks and approaches in implementation projects, illustrate some examples of how selected can be applied, and also discuss with you how a neurodisability lens can be applied when choosing and applying TMFs to enhance equity. So I'm sure many of you are familiar with Per Nilsson's landmark taxonomy of implementation science theories, models, and frameworks. This paper is now over 10 years old. It was published in 2015. But basically what he did is categorize the different theoretical approaches that can be used in implementation science, saying that some of them guide the process of implementation, some other approaches help explain the determinants or the barriers and facilitators of implementation, and some other approaches help us evaluate implementation. And that was a really transformative and landmark piece that really helped shape the field and the collective thinking about the theoretical approaches in implementation science. And I'm going to present to you a bit more on that, but the paradox is that we have many, many different options of TMFs. And that can create choice overload and also perhaps not be the best fit for a given project. Uh, there's also other issues around the fact that sometimes the use of theories, models, and frameworks is not prospective, but retrospective. And ideally, we would want to really select the theoretical approach and use it prospectively as part of a project to really inform implementation in a good way. The drivers also of how people select theories, models, and frameworks, it's already often based on familiarity and popularity. Some of you have mentioned the CFIR, the Consolidated Framework for Implementation Research, which is one of the leading frameworks in implementation science today. It's great to have common and well-known options, but it doesn't mean that we have to neglect the other options out there, especially when we're talking about equity and some determinants that are specific to some communities, for example. Then there's also some conceptual overlap or, a lack of clarity around the purposes of the TMFs and also how they work. And the bottom line of all of those things is that the selection of TMFs is often unsystematic, and that can have repercussions on the projects and really compromising the project because, as you might know, those theories, models, and frameworks can really shape how the work is conducted, what types of implementation strategies are deployed, and also how the project is evaluated. So we know that there's a lot of theories, models, and frameworks. Here are some three recent reviews highlighting over 150, 200 different unique theories, models, and frameworks. But what we endeavored to do a few years ago is to actually do a review of all reviews of theories, models, and frameworks in implementation science. And so we did that. And I started this work when I was at the Center for Implementation Research in Ottawa for my postdoctoral fellowship with Professor Jeremy Grimshaw. And we really started this, I think, in 2022. And we're just about to complete the review because it's been a huge amount of work. And as you'll see, you'll understand why shortly. But this work really aimed to describe the full landscape of implementation science theories, models, and frameworks, and to have a better understanding of the origins, the adoption, and also the influence of those TMFs. We included reviews of theories, models, and frameworks, and also included the TMFs, the individual TMFs within those reviews for analysis. And we included really evidence synthesis or systematic reviews where the TMFs were a central object of analysis, where reviews aim to identify theories, models, and frameworks in different spaces, different clinical areas, or describe, classify, compare, and so on. We've included from 2007 to 2025 a total of 51 reviews of TMS, most reviews originating from the US, Canada, Australia, and the UK. And most of those reviews aim to identify, describe, and compile TMS. They were pretty wide in scope in terms of domains that were covered. Most of them were focused on generic guideline implementation. Others had some a specific clinical focus or focused on a specific innovation like digital systems. And number of TMFs, the median number of TMFs per review was 36. So in the end, what we have identified is 773 unique implementation science theories, models, and frameworks published from 1939 to 2023. So this is a pretty daunting number. But what I want to show is within the field, there was really an initial development of those theoretical approaches that was sporadic and really a few isolated frameworks prior to the 1970s. And then in the 1990s and early 2000s, there was really a marked acceleration of TMF development, primarily anchored around the emergence of knowledge translation as a field and then implementation science in the early 2000s. And for now, the peak of TMFs in terms of number published in a single year was in 2011 with 41 new theoretical approaches. So that's a pretty significant number. Briefly, what I want to show is that I want to present the disciplinary origin of those theoretical approaches because I think it's important to understand how these tools were developed and also what type of baggage they're carrying. And essentially, a lot of the theoretical approaches in implementation science, and especially at first, like the first few decades, were heavily anchored in psychology and are still today. Psychology is still a major influence of the different theoretical approaches that we use in implementation science. The second major discipline, and especially around the 1990s, is public health. So the field of public health is contributing a lot to the development of new theoretical approaches, followed by those that emerge from medicine, nursing, business, health services research, and a few originate from education, sociology, so from those other disciplines. And I think it's interesting to notice that there's a lack, in terms of the number of theoretical approaches of influence of sociology on the field, while, what we do is inherently social work. So I think that's perhaps an interesting finding in itself. So what do those theoretical approaches do? It's really diverse. They have different purposes. Some of them are meant to guide how we evaluate projects. Some of them are meant to explain the different mechanisms underpinning implementation. Some of them are meant to guide how we design implementation strategies with 60. Some of them, they have less of an applied purpose, but are meant to clarify a concept. So what does the concept of fidelity mean? And often there's a framework for that to explain what fidelity means in the context of the delivery of an intervention. And you also have, of course, frameworks meant to help identify barriers and facilitators to implementation, and also guiding the implementation process is another major purpose of those theoretical approaches. I'm going to show you a few examples of those TMFs shortly. Before that, I want to show you this really cool graph that we did. And basically what we did in this is we took a subset of all those theories, models, and frameworks, so around 600 of them, and looked what were the terms that are used in those abstracts, the abstracts of those papers presenting the theory, model, or framework, to identify concepts that are reoccurring over time and by frequency. So what we can notice is that early on, when we go back to a few decades ago, early 2000s and even 1980s, 1970s, there wasn't really an early focus on the person and its behavior, the problem, and also different theories of behavior change. So that was the initial influence of one of the initial root of the field of implementation science. And we can think about, for example, the theory of planned behavior is one theory that was not developed in the field of implementation science, but has been now adopted pretty much and has been used a lot in the context of implementation research. Then a few decades later, we had a focus on change processes, factors, communities, and models. And this is really where process models emerged. So you can think about the knowledge to action model, for example, that presents different steps along the way around what needs to happen in order for implementation to be improved. And then finally, more recently, within those TMFs, we have more of a focus on evidence, on specific interventions, on context, on outcomes, evaluation, and frameworks. And really, those frameworks, like the Consolidated Framework for Implementation Research, for example, come in the latter portion of implementation science to help us better understand the context. So we have 45 theories, models, and frameworks that were captured in more than 5 reviews, and you can see those on the screen. And some of them you're going to know quite well, like the Consolidated Framework for Implementation Research. There's a number of evaluation frameworks like the REACH, Effectiveness, Acceptability, Implementation, and Maintenance Framework. The knowledge to action model that I've mentioned is also there. There's a number of different theories, models, and frameworks. But what we can see essentially within the field is that, yes, we've captured over 800 different theories, models, and frameworks in implementation science, but a lot of the field is really focused on using a small subset of all of those theories, models, and frameworks. What that also means is that there's a lot of equity-oriented adaptations and extensions of those theories, models, and frameworks that are often neglected because they lack visibility, perhaps, or because people are just not aware that they exist. So I think that's some food for thought, how we think about the full landscape of theories, models, and frameworks. I did a quick search. That was a bit of an ask of Vanessa to look. Are there in the 800 database of TMFs, are there some that are specific to disability contexts? So I found 5 that I think are broadly relevant. The first one is the National Center on Health, Physical Activity, and Disability Knowledge, Adaptation, Translation, and Scale-Up framework. This is really one that's focused on adapting, translating, and scaling evidence-based health wellness programs for people with disabilities, so it's quite specific. Then you also have another one that was developed in 2004, a framework for transforming knowledge into practice. And the disciplinary origin of this framework was really community rehabilitation and disability studies. So this is a pretty good example as well. And I haven't looked into that one to see if it's a process model, but it would be interesting to look into that. There's also a model of intervention fidelity in rehabilitation research, so that would be quite interesting to look into. There's a framework for conceptualizing and operationalizing fidelity as well in early childhood intervention studies. And there's also the operations triad model. And it's really in special education research, so that might be also interesting to look into. I haven't I didn't do a deep dive on each of those five models, but here's a bit more on the first one. So this one was co-developed, also involved Ian Graham, who's originated the knowledge to action model, and uh, the model that they proposed, the first portion of the model, if I may say, is the one on the left. And essentially, they propose four different strategies to really adapt, translate, and scale evidence-based health and wellness programs for people with disabilities. The first strategy is adapting knowledge and the evidence. The second strategy is disseminating knowledge and the evidence and building community awareness. Then implementation facilitation is a third strategy to promote knowledge uptake. And then update and maintain knowledge is the fourth strategy. And they also have within the paper this figure on the right where they use the knowledge to action model and also those four strategies to kind of link the two together. Now I will say as a pretty visual person, I don't love how they represented the model on the right. I feel like it could be a bit more clear. But I think it's also interesting to see where the different strategies that they propose, the four strategies, come in with the previous model that was developed. So um, now, what different types of tools exist to help select different theories, models, and frameworks? So there are a few. The KeyCast is one of them. So it's the theory comparison and selection tool. It was developed by Sarah Birkin in the US. I believe she's in North Carolina. And it's primarily, I believe it's a static tool. I don't know that there's a web-based version, though this link that I put in might be the web-based version. Um, and it does provide some guidance. There's also the DNI models website, so dissemination-implementation.org. And there's the Find TMF website. And what I'm going to talk about a bit more today, the Selected Meta Framework. Now, we don't have a website yet. I hope we'll do soon in the future. But I'm going to talk about the implications of the framework that we've developed to help structure the thinking around the selection and use of theories, models, and frameworks. And the way that I see things as they are now is that you can use the framework that we've developed and some of the tools in it alongside the other websites and that have a database of theoretical approaches to help inform the selection of theories, models, and frameworks. So this is the paper that was published last year, and we initially did a scoping review and then developed the framework. So this was published in Implementation Science, and what we aimed to analyze was really what are the reported purposes of theories, models, and frameworks in implementation science? What are their attributes, their characteristics, and what are the practical considerations of theories, models, and frameworks? And the way that we define those different things, I think, is important to understand. Really, the purpose is really the primary goal or function that a TMF fulfills within implementation science. And I've talked about many of those purposes already, guiding the implementation process and the different steps, helping identify barriers and facilitators, and supporting evaluation. An attribute is really a distinctive characteristic to help define how a TMF operates or explains something or supports implementation efforts. So it could be the extent to which the constructs of the domains of the TMF are clear. It could be the extent to which the TMF constructs are measurable. It could also be the evidence supporting a TMF. So those are some of the attributes that we've looked at. And the practical considerations are really project or team-specific factors influencing the selection of TMFs in real-world settings. And that can be the acceptability of the TMF to you if you're looking at it, or your team, or partners, or community members. the availability of the resources as well to apply the TMF in the context of your project, and the fit with the project context and your population. So the framework that we've developed has 4 steps. So the first one is really to determine the purpose. So why are you using a TMF? And a really simple purpose is, guiding the implementation process, guiding the different steps. What do we need to do first? What do we need to do in second? What do we need to do in third? And so on. Another purpose would be guiding the identification of determinants. And so we've identified a total of 7 different purposes. So that expands a little bit what was presented by Per Nelson a few years ago. And there's a bit more details in table 2 in the paper, with some additional information on what those different purposes mean and which articles were reporting those different purposes. And sometimes, for example, a really simple purpose could just be, like I've mentioned earlier, to enhance conceptual clarity around a concept. And when I presented the 5 TMFs in the disability space that I've identified, 2 of them were around conceptual clarity, around intervention fidelity. So that could be a purpose of using such a TMF. And then you have the other purposes that we've listed below. So those could be as well to guide the design and adaptation of implementation strategies in support of an intervention, a clinical intervention, to guide evaluation and causal explanation, or to guide interpretation and dissemination of your findings. So 7 different purposes. And there's a few examples in the paper, but we've put in the results section a few examples of TMFs for the different purposes as well, if you want to look at that. So now that you've made your choice around why you want to use a TMF, and often it can be that there's 2 or 3 different purposes to the use of a TMF or multiple TMFs in your project. In my context, often when I do a project, I'm going to for sure have a process model to guide the implementation process. I'm going to have a barrier and enabler framework to guide the identification of determinants, and I'm going to have an evaluation framework to guide how we evaluate the project. So often it could be that you have 3 different purposes of the use of TMFs in your project, or 4, and that's going to guide your decision-making process. Then the second step is really to identify the possible options. And I've presented to you a few reviews. So those 3 reviews are there and can help you. They provide an extensive list of different theoretical approaches. But you can also use those different tools. So Find TMF, the dissemination and implementation models in health. They both provide pretty well structured interactive tools to guide the selection of theoretical approaches, and often they can link those TMFs to a specific purpose. So that's a really practical resource. My hope is that we're going to be able to upload the 800 TMFs database that I've presented to a web-based resource that's going to form another platform for you to look at the possible options. What I will say as well that you can try to use is to use actually generative AI to help you find sometimes less known TMFs. So for example, if you do clarify your purposes at first and you say, I'm looking for a framework that's going to help me guide the design and adaptation of implementation strategies, for example, you can use generative AI to help you build a menu of a few options, 2 or 3 options perhaps, and then you can cross-check those options with the resources here. So that's the second step, is to shortlist a few TMFs that appear to be fit for purpose. And often what you could do is to use a well-known TMF as one of the options. The CFIR is very well known as an option, as a determinant framework. But then you can also look for adaptations or extensions of the CFIR with an equity lens. And that could be another option that you capture alongside in your shortlist. And then the other aspect that we're looking at with the selective meta framework is that we've through the project and the development of the framework really put a lot of thought into what should be the factors that justify the selection of a theory, model, or framework in implementation science. And often that's a question that is relevant, yes, for implementation science, but also for other, to be frank, areas of healthcare research where there's a use of theory, and often the justification for the use of a theory is not extremely transparent or that well justified. And at a high level, what we propose as the 5 domains to consider are the following. So first is really the clarity and structure of the theory, model, or framework. And I can tell you, having looked at many, many different options of theories, models, and frameworks, that this is not, it doesn't look as it's not as simple as it sounds, because often, you look at a theory, model, or framework, and then, there's no diagram representing what it looks like conceptually. The constructs are not well defined. You don't really know what each of the things in the framework means. So really, that's the first aspect, is how is the TMF presented, visually speaking, and structured, so you can easily understand how it would work within the context of your project. So this is really the clarity and the structure in the first major domain. The second domain is really the scientific strength and evidence behind the TMF. And, for some TMFs, there's going to be a lot of evidence behind its use, like going again to the consolidated framework for implementation research. We know that it's been used in a range of clinical areas already, to some level of success to help identify what are the barriers and facilitators. So it can be an indicator of applicability to your context, and if there's evidence that it's been used successfully in the same population or in a similar setting or for a similar type of intervention. So this is really considering what is the evidence and how the framework has been used in the past. Now, for some theoretical approaches in implementation science, and especially theories are meant to be tested, right? They have a predictive or explanatory ability to them, which is not the same that a framework or a model, which, a framework is really a list of constructs, and a model is really different steps pretty much that are linked together. So a theory is a bit more specific in that it could be tested as part of a study. So it's often interesting to look specifically for theories. Have they been tested? Have they been, have their propositions been supported or falsified in the past? So that's a nuance for theories in relation to models and frameworks. The third major domain is the applicability and usability dimension. So that is really saying, in a pragmatic and practical sense, are there any tools that are available to actually apply this thing and this tool, right? So the CIFR is a good example, and many other frameworks have websites where you can actually go in and download an interview guide, a questionnaire, and an Excel matrix to help you analyze the data. So really, those are the factors related to how usable and accessible the framework is in a day-to-day fashion. And then the fourth domain is around equity and sociocultural responsiveness. So it's about those attributes look at, and this domain broadly looks at how is equity considered in the TMF. And that's an issue often of some older theories, models, and frameworks. I will say there's a number of TMFs that have been developed, as you saw earlier in the presentation, in the 1980s, 90s, and early 2000s, where equity wasn't necessarily that well explicited conceptually and in terms of something that we should address and measure and also consider as part of implementation. So this domain really looks at assessing how is equity considered. And then finally, the last domain is really around how is the system, the health system, and partners considered as part of the TMF. And I'm going to give a really simple example again. If you're going to use the theory of planned behavior, for example, it's a very individual focused theory looking to explain how someone is going to change their behavior, whether that is a patient or a provider. But it doesn't necessarily have a good understanding or representation of the health system and how partners interact in the context of implementation. So that would be a limitation of this model. So those are the 5 domains. Now, if you read the paper, you can actually see that within those 5 domains, there's a number of sub-constructs and attributes that you can look at. There's additional details and questions, but I won't go into the detail of all of those today. And I'll focus next on the fourth step, which is, now that you've looked at those 5 domains and you have a good understanding of those, it's really looking at, can you use the TMF within your project context? And do you have the expertise and the readiness to use the TMF also? And that's a pretty simple domain, right? It's really looking at the skills of the team. Now, some theories, models, and frameworks are more complex to use than others. For instance, using a process model like the knowledge to action model doesn't necessarily require a lot of expertise in terms of its application because it's just guiding the different steps. However, if you're going to use a model like the CFIR to code barriers and facilitators to implementation, then you need to make sure that people are comfortable, asking questions and prompting in the context of an interview, perhaps, or also coding the barriers and facilitators in the interview once it's done. So those are things that we need to consider. There's also a number of other factors within this domain, like the availability of resources, and we have to take into account how labor intensive it might be to use a TMF, and also whether or not it's a good fit in the end for your project in terms of available data, the purpose of your project, the populations that you're working with, the interventions. If you're assessing at a very foundational level, if you're assessing a very clear clinical intervention that is patient level, you wouldn't go and take a policy level framework, right? So that's why it's important to assess the fit with the interventions. So, and we've developed a worksheet that you can use, and those are the additional files of the paper. And this is really looking at 5 steps, really. The first one being step 0 being to specify what is your implementation challenge? What are you seeking to do in the context of your project? And why do you need implementation science to address this? The first real step is to determine what is the purpose or the 2 or 3 different purposes of using a TMF in the context of your study. Then you can list 1, 2, or 3 options per purpose that you assess, and then briefly justifying, is the TMF clear, yes or no? What is the scientific strength and evidence behind the use of the selection of this theoretical approach? Do you find it applicable, usable? Is it considering equity and the 5 domains, basically? Just this justification can be more long or less long, depending on how much time and resources you have. But it's meant to be pragmatic. And then what are the practical considerations, if any, of using those theoretical approaches? And what we hope is that this process can help have a better justification of the use of theory, and especially when it comes to publishing different projects and, looking back at why this specific theoretical approach was suggested or perhaps used in the context of the project. We're going to be able to look back at that and attach this spreadsheet as an appendix to the project. We have an example that we've put in also in the paper, looking at improving hand hygiene compliance in a pediatric hospital. So you can see how we've compared 2 different theories, models, and frameworks using this spreadsheet. So, in conclusion, the key contributions of this study, we've helped, we believe, with the selected framework, really clarify the 7 purposes of TMFs, identifying the 5 main domains that can justify how we select theories, models, and frameworks in implementation science. We've also done a lot of work, as I've presented, to distinguish the attributes or the characteristics of the TMFs from the practical considerations around their use and the project and team specific factors that these represent. And this is an improvement over existing tools as well. Now, I've presented what the selected meta framework is, and we believe this really builds on previous tools and can be used in conjunction with other tools that exist. And my vision is that we're going to be able to use AI alongside of this tool and also alongside the database of TMFs to really have an easy to use but rigorously developed decision support for the selection of theories, models, and frameworks to go beyond some of the most common options of TMFs and really address better equity because a lot of the different theoretical approaches that I've presented that were developed over the last 5 to 10 years are really equity-focused adaptations and extensions of common TMFs. And if they don't have the visibility, then they're not going to be used as much as the most common options. And to me, that's an issue that we need to address. So thank you so much for listening to me, and I hope we have a bit of time for discussion.
Fabulous. Thank you so much. That was amazing. And just congratulations on the tremendous amount of work that your team have done in bringing together, consolidating over 700, 800. That's ridiculous. Also not surprising, but still hearing that number, I was like, oh my goodness. And I really like how you've really brought forward some practical recommendations that researchers, practitioners, whomever is engaging in this work can really think about. I love the linking and bringing in of those attributes, specifically the systems equity piece, I think is really missing. And so I really appreciated that. And I think what you've proposed really helps bring the intentionality back into some of this versus just thinking about, I'm using the CFR because that's what I know, or that's what, my team uses, and really thinking about it more deliberately, I think, and allows you to map out that process and justification. So I appreciate that a lot. And I love the Gen AI piece because I never would have thought of that to think about, especially the adaptations and the extensions of some of the existing TMFs. I think that's really, really interesting. So I'm excited to see what the tool operationalizes and what becomes of it as you think of bringing it into some sort of web-based format. But it's very exciting, and congratulations. And thank you for being here today.
Thank you so much.
I sent you, I know, a bunch of questions already, so I have a bunch of questions for you. But I do see we have a question. So thanks for the interesting presentation. I find it interesting that as the field of implementation science evolved, as described in the network analysis, it moved away from the focus on the person. Can you please speak to that?
I think it's moved away. That's a very interesting question, right? And even today, the behavioral focus in implementation science is still very much there. So because psychology is such a big influence in implementation science. But I think it not necessarily moved away from the person, but moved to include other things beyond the person. So that's what I would say. It moved to include the social network around the person. It moved to include the organizational context. It moved to include the health system context. So all of those things were progressively incorporated into how we think about implementation. So I wouldn't say that the person is no longer the center of implementation. I think very much, if you look at common implementation science, TMFs, they all have the individuals as one of the key pillars of what we need to think about, of course. But now we have that broader perspective around the person.
Yeah, very interesting. That's a great question. Okay, so I might then ask, and then Audrey, obviously, if you have a question, please do ask. So In terms of thinking about who's in the audience today and KBH Plus as a network and Child Right as a network, and you talked a lot about too about around engaging your team, engaging community members, whomever's involved as part of the process in selecting and also applying TMFs. I'm wondering if you could speak to your experiences engaging people with different lived and living experiences, different varying knowledge and expertise with using TMFs in this process, and what we can take away from that to apply to our own projects.
That's a very good question. So I think, generally speaking, engagement should occur before any TMF is selected, right? We don't want to select. Often it can be a bit difficult because you might obtain funding and then, you're going to start the project. But really, if we talk about the development of a funding proposal or any sort of project proposition, we should really seek to engage individuals and with disabilities, caregivers, families, and service providers before we start thinking about which TMFs we're going to use. And really, those people should, to me, provide an input on the decisions that we make. And that's the approach that we've taken. So I work a lot in community-based implementation research, and we've with the people that I work with, there's intersections and different forms of oppression and structures of power that have a big influence on how they live. And often those people, I work with a lot of people who inject drugs, and often people who inject drugs, also happen to be indigenous in some instances, and also happen to be women, and also happen to be queer. Like there's a lot of different social identities that intersect and shape who these people are, and also how they experience and engage with care. So I think it's really important to do that engagement with them to make sure that the project is designed in a way that is going to address those nuances and really address those structural barriers to engaging with healthcare. And that also shapes the choices of theories, models, and frameworks that we're going to use, right? So I would say that that's the approach that I take.
Okay, yeah. And hearing you speak there also made me think about we're seeing a lot very recently more so, but I think also just trickles of it throughout several years around how we can think more intentionally about decolonizing implementation science and some of our approaches there. And I'm wondering if you've ever seen anything in the theories, models, frameworks, some of these processes that are explicitly acknowledging those present day impacts and some of the important engagement implications that you alluded to as well.
So that's a really good question. We recently completed a scoping review of all theories, models, and frameworks centered around equity, and it was an interesting, let's say, exercise because this project was conducted with Indigenous scholars as well and partners, and for them, a lot of what we were discussing with them was around the fact that equity for them is a bit foreign and doesn't really mean what it means in other contexts, and that decolonization is of course central. And so just the terminology and the language around that we use in the context of this project was a really an interesting discussion. But we did find, I believe, 45 equity oriented TMFs.
Mm.
And this paper is under review in implementation science. And what we did is collaborated with the Indigenous scholars and also experts in equity to look at those TMFs specifically in a critical way, to do a critical appraisal of those. And I think we had 8 different criteria that we looked at for those TMFs to assess to what extent were those equity centered, pretty much. And only a handful of the 45 address all criteria in a good way. So perhaps in my memory, it's been a few months, but was 5 to 8, I think, out of 45. And quite a few of those were Indigenous led in terms of development. So they proposed, there was really strong components around governance, data sovereignty, self-determination, and all of those aspects were central to any product proposition. So I will say that that is probably the best
Yeah. Yeah.
advances from those standpoints in implementation science for now that I've seen.
I'm excited to read that paper and see that because I think that's yeah, very important contribution. And you speaking, even though there's like 800 TMFs out there, I was like, I feel like there's so many more that we don't even know about that might not even be published in the traditional academic spaces that we work in. So yeah, I'm excited to read that. Thank you. I noticed there's some comments, questions in the chat. So noting that that's a helpful clarification. And then a question, does this model mention the compatibility of TMF with each other, especially regarding health equity?
That's a really good point. There's no specific phase that's centered on compatibility, but it is an attribute of one domain. So within applicability and usability, there's an attribute looking at how this TMF compatible with other TMFs. So it's something that we encourage considering as part of a given project because we believe that we need to combine different TMFs and especially to capture some nuances at the community level. That's yeah. So it's part of the process.
Amazing. And then I see another comment, question, reflection. Yes, how do you ensure that community ways of doing is leading versus the or a colonial theoretical construct?
So, I mean, I think it starts with the way that the project is governed and created, basically, right? It has to be either, like, if we're talking specifically about, I'm not Indigenous, right? And I can't speak to the self-determination of Indigenous communities and peoples, but it's really starting from being led by Indigenous communities or partnered, really, so have Indigenous leadership with other form of other partners that come along the way. We're doing a scoping review. We do a lot of different reviews in the team. It's not a surprise, but we're doing another review on, and we've just published a protocol. It's on my Google Scholar page if you want to look at the latest paper that we've published on Indigenous-led and Indigenous partnered implementation science globally. And this is really looking at how do we establish authentic partnerships and in the context of implementation science and what those look like, what sorts of strategies are used. So I don't have a good answer necessarily to what that looks like, but I think it starts with the partnership and the leadership structure.
Fantastic. Thank you. Some really good, some really good questions and discussion. We have about 1 minute. Audrey, I feel like I've been capitalizing on the questions, so I wanted to give you an opportunity if you have a question. If not, yeah,
Thanks, Vanessa. No, it was a great presentation. Thank you.
awesome. Okay, then maybe my final question for you would be around this tension between, or maybe I'll speak for myself, sometimes the tension between adapting and adaptability of some of these TMFs, and what would you recommend? And I think I really appreciated you speaking to the adaptations, the extensions of some of these, and just any maybe final, recommendations or reflections or takeaways for the group when thinking about tailoring these to their projects.
I mean, I personally appreciate all of the adaptations and extensions. I think those are critical, especially within an equity context. And I often hear, people say, you only need like a few TMFs and like we don't need all of those options. But to me, that's, striking down a core component of equity-oriented implementation research. And the reason why there are those adaptations partly is that because the major options are not fit for purpose, right? So yes, so I'm all about, having more options of TMFs that are fit for different purposes. that are developed in a thoughtful way and that extend on our knowledge of how to make things work within implementation science. So I think that's a good idea. I think we have to be careful about, too much development of TMFs, especially when we can learn from what's been successful elsewhere. But broadly speaking, I really appreciate the work that's done in this area, and I think it's important.
Awesome. Totally agree. Thank you. Thank you for taking the time to be here, for sharing your expertise, and congratulations on your recent accomplishment. That's very exciting. We really appreciate you being here and sharing with us, and hopefully one day we'll be able to all connect again soon. And I look forward to seeing your recent or upcoming publications and work. Thank you.
Thank you so much, everyone. Thank you for the invitation.
Thanks everyone for being
Yeah,
here
take
for the
care.
discussion. Bye.